guys, welcome back. My name is Charity. I'm a pharmacist, and today we're going to talk about what it means when you have low calcium. So low calcium is called hypocalcemia, which just means low calcium in the blood. Calcium is a mineral that your body uses. It's used in the central nervous system, and it can have effects in your brain, with your muscles, and your heart. What is going to cause someone to have decreased calcium? Well, if you have impaired kidney function, if you have inflammation of your pancreas, or what we call pancreatitis, if you have low vitamin D or magnesium, even low parathyroid hormone, these are things that can cause your calcium to be low. Absorption issues, if you have some issue with your GI tract and you're just not able to absorb minerals, or that could cause you to have low calcium. And then also if you take certain medications, that can affect your calcium levels in the blood as well. Now, symptoms, what are you going to look out for? A lot of people will know numbing or tingling in the fingers or the toes. You can have muscle twitching, aches, cramps, and pains, a fast heartbeat, and then an abnormal heart rhythm. A lot of patients will have memory issues like confusion or even difficulty thinking. How long term, what do those symptoms look like? Long term, you can have brittle hair and nails, dry skin, and then it can even lead to dental caries or cavities in the mouth. How is it diagnosed? We are going to diagnose you by drawing your blood. So you're going to go have some lab work drawn or some lab work done, and we're going to draw the blood and we're going to test your calcium level. Now, typically low calcium is going to be right around anything less than 7.6 milligrams per deciliter of blood. Now, different institutions will vary from that number, a little to the left or a little to the right, but right there in the middle at 7.6 is about what we're looking at. Now, how are we going to treat it? Treating hypocalcemia is rather straightforward. We are going to resupplement. So depending on how severe your hypocalcemia is, oral supplementation may be fine. Or if it's more severe, you may have to have IV or intravenous calcium infusions to supplement to get your levels back up. We're basically, like I said, just gonna give the mineral and electrolytes like magnesium to help get your levels where they need to be. Now, if you feel that you are having difficulty, or if you have just received some lab works and your levels look low, most times a provider is gonna reach out to you. But if you did it independently, you want to make sure you follow up with your provider and stay on top of taking your supplements, keeping your doctor's appointments, and writing down whatever symptoms that you're having so that you can document and report back to your provider what you've experienced, what you're experiencing, if things are getting better, they're improving, they're staying the same, or they're getting worse. Now, I hope you have enjoyed this video. I hope I've given you a really quick and dirty explanation about what hypocalcemia is, what it looks like, how we test for it, and then how we treat it. I invite you to join my community by subscribing to my channel. Leave me a comment below. Let me know if you've ever had hypocalcemia. How did you know? And what were your symptoms? Like this video, share it with a friend, and turn on notifications. And until next time,